You, Melinda. We'll move right down the line to Bruce, who's the president and CEO of the SCAN Foundation and who held the group's feet to the functional fire throughout the course of the work, as Peter mentioned earlier.
Well, it's a pleasure to be here today, and like everybody before me, I want to begin by acknowledging the great work of NAM, the Peterson Health Institute for their funding work. Peter, we all have to have a moment to pick on you. This is mine. So thank you for your leadership in kind of herding cats in an area that, you know, frankly, we've been chasing our tails for a long time. So I want to sort of build on where Melinda's comments left off, which there's been a lot of work in this space, a lot of it very sort of discoordinated, I think, and trying to bring some rigor to this and ask us to all at least run in the same direction as opposed to in a circle is, I think, a great opportunity. I want to pick up, so I have three comments. It's about need, not use. It really is about scaling as opposed to piloting anything new. And finally, I think it's all really about value and measurement. So I'm going to start with something that David said in the previous panel, which is this idea that we ought to really start with the people who need services and care and understand what their needs are. And while I think this is a wonderful report and an enormous amount of work, I think one of the concerns I would raise is that it continues to plow in some ways a pretty traditional path, which is let's go look at claims data. The claims data will point us in a direction. I mean, I'd point all of you to the chart that shows what were used as sort of functional metrics as sort of a proxy for identifying folks with functional needs. And it's, you know, the technical work is fabulous, so this is no critique of the, at all of the analytics, but the measures are awful. They don't look like people. It's sort of like saying, I went to the zoo and saw an animal. It's like, yeah, well, what kind of animal did you actually see? And then you can't actually name it. So I think we're very hidebound by the data sets we have and our sort of desire to retread them in the same way. And we sort of get similar results. And, you know, frankly, MedPAC has done the same thing. They've sort of looked at function. They've done basically the exact same analysis using the exact same, pretty much the same claims data sets. And, you know, they get kind of the same results, which is, gosh, we can't really make function work for us as a way of improving the payment model, for example, or the risk stratification model. So it says that we need sort of new eyes and new kinds of creativity. And it gets to this first point, which is use is really important. Use tells you about where opportunities may be today, and it tells you where your resources are going, but it doesn't really get at need. And the gulf between need and use is incredibly important. And I like the way I think the publication begins to sort of lay out that challenge for us. And I think for the taxonomy, it's one of the real strengths, which is it embraced this concept head on in ways that, frankly, no other document in recent memory for me at this level of visibility has done. And I think we need to embrace that challenge, because ultimately, if you start to understand what's really important to people and you start to meet those needs, then maybe we would get improved utilization and improved outcomes. But because we sort of start with, you're utilizing these services, like, so what? Somebody has hyperlipidemia. So what? It's a chronic condition. It's, you know, in the big scheme of things, it may not be the most important one. And then you see, well, somebody's had a paralytic event. Well, I really want to know all the underlying things that led to that paralytic event. Was it microvascular disease, macrovascular disease, high blood pressure that wasn't managed? So I think, like, I love this document for what it tells us, and I love this document for what it challenges us to think about. And again, I think this idea that it is needs that will ultimately drive utilization and performance, and looking at utilization is a step removed from that. And so that, I think, gets to the second issue, which for me is about scaling. And I think why I'm so proud of our partnership with the Peterson Health Institute, the Commonwealth Fund, the John A. Hartford Foundation, and Robert Wood Johnson, where we're all trying to come together. And I'm going to let Don talk a bit about the playbook itself, but this idea that you know, the amount of philanthropy dollars that are out there to do anything, given the size and shape of the healthcare delivery system, is incredibly small. And we are unhelpful if we continue to identify little one-off solutions that aren't linked to one another, and we can't try to communicate more effectively about what an opportunity set may be. And the idea that we've come together with the notion that there are proven examples of things that work. There's a lot of information out there about what works right now. And trying to organize that in a way that people can reach that. And frankly, we're just as happy if the for-profit consulting firms that are busy running around in lots of healthcare delivery organizations helping them try to manage their high needs folks, or whether it's academic organizations, or whether it's organizations that are big enough to try to build these models on their own, like New York Health and Hospitals. All of those are opportunities to improve care, and we embrace all of them equally. Improvement is what counts. So I think for us, the idea that we would try to come together to curate that information, to try to communicate together the importance of what good information looks like, and also but to try to identify where there are holes, because there clearly are holes. If we had better measures, we would be using them now, and we don't have them. So I think the idea that by us being able to call them out collaboratively also presents opportunities for us to fund and try to fill some of those holes collaboratively. And I just really want to acknowledge my colleagues who are in the room, because I think it's a big step in the right direction. And I think the playbook is the first step in our shared commitment around supporting scale and implementation. My last thought on scale and implementation before I get to my last point is, this hasn't come up yet, so I just want to take it on directly because maybe it'll lead to questions. For those of you who are addicted to fidelity to my model, I wish you luck. And for those of you who've actually run real delivery systems, you understand how important it is to understand the population you serve, to understand the wonderful organizations that can be in your community, that can be your partners in the community, to actually help you achieve better outcomes for those you serve, the people you serve, not just the patients you serve. And so I think what's really lovely and important about this report is that it identifies key characteristics that all healthcare organizations should be looking at studiously. And they need to solve for all of those characteristics. I mean, if there's anything that's true about healthcare, we solve all the easy ones, but like the weakest link, the one that's like, oh, no, we can't do that because those primary care doctors, and I'm one of those, will never go along with this. So somehow that weakest link around care coordination, or a more realistic example, single point of contact. How close does your organization get to a place where they can call somebody and get the phone answered when they have a need in real time on their schedule, not on the health system schedule? It's a really hard thing to do, but it's actually very important. So I raise this because I think pushing to models that work and helping organizations scale is about really embracing the resources you have, solving the problems on the ground in front of you, and partnering effectively with the community. Finally, and I see Peggy O'Kane here, which makes me really happy, and we have really key academic folks in the audience today. For those of you who are watching, we need a new set of measures, folks. Chasing diseases is not the answer to this question, and until we have measures that value succeeding, thriving in community, where we look at goal attainment measures and person, not patient-reported outcomes that are really important, and that we actually tie value to those measures, it's going to be a slow slog. And so I would just encourage all of us, and I'm encouraging my partners, my collegial foundation partners around me here, to embrace that challenge. Yeah, because I think, if we want value to really occur, it's not just about use, it's about need. And being able to measure and reward addressing need in very high need, high cost populations is how we'll get to where we want to be. And with that, I want to turn it over to Don and let them speak to their leadership around the playbook.